name is Warren Kerr. I'm the National Director for the Sharley Health Group. We're a specialist group of architects, health planners, nurse planners, equipment specialists who just have focused on that. Myself, I have qualifications in architecture as well as health administration, so I've been involved in the design of major hospital projects for the last 25, 30 years. I enjoy it immensely. I find that every project's different, and you have the opportunity to interact with a whole range of people and work with them to make the best outcome. I think evidence-based design's made a huge impact on hospital design. When I first started, it was all about creating a building in which healthcare services were delivered. And through the research that's been undertaken with evidence-based design, we found that the building itself can make quite a significant impact on the recovery rates for patients, how they feel about their stay in hospital, and how the staff and patients interact in that environment. So evidence-based design was started in the United States. A gentleman, Professor Roger Ulrich, who's now become a close friend, has started research on the impact of the building and the health environment hospital buildings have on recovery times, and found that if a patient has a quiet environment, an environment in which they have some control over, have an outlook that looks at nature and is less stressed because of having some control over that environment, that their recovery rates can be significantly improved and therefore their length of stay reduced. And on a major hospital project where you may have 600 or 700 beds, if you can reduce that length of stay by 1 day for every patient, then you are increasing the throughput quite dramatically. I think one of the important issues is information sharing, and at the moment there is no central research group in Australia looking at hospital planning and design. There are similar institutes elsewhere in Australia, the most notable, elsewhere in the world, sorry, the most notable being in the United States with the Centre for Health Design, and in Europe and in South America. They all have these institutes. For one in Australia, the benefit would be to share the information learnt on different projects around Australia, what works, what doesn't work, and how you can then use that innovations on new projects. I've just been involved in the design of the $2 billion new hospital in Perth, the Fiona Stanley Hospital project. We had a team of 60 architects working on that. The next major project's going to be in Queensland, and very few of the architects or engineers involved in the one in Perth in Western Australia will have the opportunity to transmit that knowledge to the next big one in Queensland. Because of the state system and the various separate state governments, there isn't a lot of sharing of that information. To have a research centre where we could share that information, act as an information broker, link with overseas research institutes, I think would help a great deal in terms of improving the way we go about hospital planning and design in Australia. Another aspect that would also help is at the moment in Australia there are no postgraduate programs for hospital planning and design, and it's something in a country of 22 million people we could only support one centre, but to actually have a central centre where for postgraduate programs where experienced architects, engineers, etc. could learn about the complexities of health. I had the opportunity when I was working with the Commonwealth and state governments to get trained in hospital design, but many of the architectural practices in the private sector don't have the resources to provide that training. To have those postgraduate programs and for architects, engineers, project managers especially, to understand the health environment, I think would add a great deal of value to how they then go forth in their career to deliver more effective healthcare projects. I think with conferences there's always two aspects to it. One's the quality of the presentations, and we've been privileged I think today to see a whole range of very good presentations where people have spent quite a time and effort on conveying the message they want about some very exciting health projects that are occurring around the country. And the second aspect of course is the networking and meeting colleagues and peers and finding out from them how their projects are going and what they need to do. So it's been a very useful exercise I think over the past 2 days to get all those involved. It's one way of sharing that information from the various states and government authorities around Australia that are undertaking major hospital projects.